first time since the 1930s, the death rate of cancer is declining. It is the leading cause of death in America. Cancer somehow affects everyone in some way. You either know someone who has had cancer or you've experienced cancer firsthand. My experience was with my grandmother, who developed ovarian cancer and died when I was just a baby. With technology and advances, we are slowly winning the war against cancer. Scientists aren't sure if they can find one cure for over 200 types of cancer, but there's other evidence that we are beating cancer. This evidence includes screenings for early detection, environmental and personal behaviors, and treatment changes for the future. Screenings and early detection have increased the chance of success for treatment. Screenings are a simple test that doctors can give you to see if you might develop this cancer in the future, even if you aren't showing symptoms now. Types of screenings that are available to most of the nation are mammograms for breast cancer, colonoscopy for colon cancer, and pap smear for cervical cancer. According to American Cancer Society, 60% of breast cancer cases are diagnosed at localized screening stages. Screenings have saved many lives, including a role model of mine, Juliana Rancic. When, at the age of 36, Juliana was having trouble getting pregnant. She went with her husband to Colorado for IVF, and just based on procedure, they told her that she needed a mammogram and other tests to see if she was healthy. Little did she know that at age 36, she developed breast cancer. Because of screening and early detection, she was able to get a double mastectomy and be completely cured of cancer. Screenings have also saved so many lives, and after Juliana Rancic went out into the public and encouraged women to get their screenings and early detection, and I'm sure she saved many lives. Like screenings, personal and environmental behaviors have helping us beat the war against cancer. Lifestyle and diet can either prevent or help cause cancer in this age. The most impactful one is smoking that leads to lung cancer. We, over time, have looked down upon smoking, and because of that, the death rate for lung cancer has decreased. According to Centers for Disease Control and Prevention, the percentage of adults with lung cancer fell from 42% in 1965 to 19% in 2012. Like the decrease in smoking as a behavior, there's also behaviors that people have started to use to prevent skin cancer. Just the simple act of putting on sunscreen, staying in the shade, covering your body have helped not cause skin cancer and is decreasing the death rate. Society is now more knowledgeable about the effects of cancer and ways to prevent them. With healthy exercise and diet, people are more aware of it and are helping fight against cancer. Another type of evidence that shows that we are winning the war against cancer is treatment changes for the future. These include surgery, chemotherapy, and exercise advances. Scientists are now more knowledgeable about what causes cancer and how to treat cancer. So they've been starting from early lab studies to large-scale clinical trials to try and find cures for this. There is a new generation drug that is in development right now. According to American Society of Clinical Oncology, doctors developed a new generation drug specifically targeted to just cancer cells in your body, rather than killing both good and bad cells like radiation and chemotherapy. They're designed for specific cancers, and it's hopefully going to hopefully it's going to cure more cancers. Studies take many years to complete, so it is hard right now to look at statistics, but cancer is definitely going down and we are winning the war against cancer. Because of all of this evidence, it's shown that we are doing our best to prevent it. However, inevitably, some will lose the battle of cancer. Some people will die, but for the first time, we are gaining a step in the right direction with cancer falling. The key to this is prevention and changing lifestyle behaviors. Sometimes it's not just one war. Sometimes cancer is not just one war in curing it, but it's many individual ones. And hopefully with ovarian cancer in my family from my grandma and my mom's side, I'm hoping that with this technology and development that I will know in my screenings and I will detect it early if I do have it, and I won't suffer